Hello, beautiful people, and welcome to the Botanical Biohacking Podcast. Finishing up our series on pain with Dr. Tom Whalen, we're going to be exploring the concept of kidney yang deficiency, which is a warming ability that the body has that, when decreased, is associated with pain, particularly lower back pain from a traditional standpoint. This pain is associated with decline in sexual function and other signs that today we would call sex hormones.
And many people who come in to see me with pain are often shy about admitting, but they're also very bothered by the change in their sexual activity. They attribute it entirely to the pain that they're having, but there are also cellular mechanisms working to decrease their sexual activity.
One of these in particular is having depressed levels of ACTH, which is adrenocorticotropic hormone.
So when we are initially injured or faced with an injury and the fight or flight response, our bodies have a natural mechanism to gear us up to meet the challenge, whether the challenge is physical or emotional or psychic or spiritual. Our body responds by releasing ACTH that releases cortisol. We also have a release of epinephrine and norepinephrine. And all of these signals put our body on high alert, which is what we need for the short-term response to the danger. When the danger has passed, if the hypothalamic pituitary adrenal axis stays on high alert, we eventually experience a depletion of the hormones. And when that happens,
the body loses the ability to relax and control inflammation. This lowered cortisol is associated with stress sensitivity, fatigue, fat gain, poor sleep, and low body temperature. People with this will often feel like it's cold and they can't seem to get warm. They're often depressed, have trouble remembering, and it's often associated with hypothyroidism as well.
Yes, and people who come in to see me so people often present with this constellation of symptoms, or at least some combination of these symptoms when I first see them, even when they're in stage 1. So why don't we immediately jump to this formula to treat these people when they come in at stage 1?
Increasing these ACTHs can set up as a precursor for increasing a gas called hydrogen sulfide. And this is a powerful antioxidant in the body. And during stage 1, we want to make sure that the immune system and the inflammatory system is working at its best. So introducing something that may be anti-inflammatory is traditionally seen to be drawing the disease deeper inside the body. With stage 1 and stage 8, in both cases you may be dealing with a kind of cold feeling. With stage 1, it's the kind of cold that you get with a common cold. But with stage 8, it's a kind of cold that never goes away. It's just the thermostat is set low, and it's very difficult to increase it. Now, using these herbal formulas in rat studies, they've shown to increase the rectal temperature of rats. Not a job description you really want. Just think, you go to college for so many years to be testing rat rectal thermometer, rat rectal temperatures. At some level, you feel like you failed in life, but the research is very important because that thermostat is
Keep telling yourself that research is very important, Andy.
all right.
We know which lab you've been working at.
I've got a hobby. So with the depressed body temperature, it's associated with this drop in your body's own corticosteroids. So if you go to get a prednisone injection, these are steroidal anti-inflammatories. And this is very important because your body, when it's not producing enough of these, will need some kind of external help. However, you do want your body producing these steroidal anti-inflammatories so that you're not in a state of chronic pain long term.
Right. So as another way that I see it is we're trying to get the body at this stage to better control its own cortisol secretion. And the cortisol secretion is going to put stressors downstream on all the cells. And if the cells downstream don't have any reserve built up, they're going to get burned out very quickly. So having built up the chi and the blood, we're now in these stages where we can get the body to find that sweet spot where the right amount of cortisol is being produced internally rather than relying on a shot of cortisone from the doctor.
In the case of a traumatic injury, when the cortisol is spiking, using something in this category of boosting kidney yang can further raise the cortisol levels, which you may not want if they're already jacked up. This is the same hormonal cascade that causes your otherwise loving dog with an injury to bite you when you try to help it. So you can see that it's adding fuel to an already burning fire.
Right, except in this case, it's a very cold fire.
Yeah, it's over time it burns out, and then once there's burnout, then there's this low temperature. So one of the first cases that I saw, I was right out of school, and I had just set up a clinic, and to be honest, I was terrified. I thought, oh God, I'm not going to be able to pay the rent. And the first guy walks in, and he's bundled up, and it's summer. I mean, it's just the end of summer. It's probably, the end of August. He's bundled up like it's the middle of winter in the Arctic. And he walks in, and his tone of voice is very weak. He says, I have this rare endocrine disorder, and nobody can figure it out. And I had just been spending time in the hospitals in China around some of the top doctors in that area in Chengdu, seeing 50 to 100 patients a day, and they make snap judgments. They know what's going on. That was the kind of mode that I was in. I just stopped him there. I said, look, yeah, you're waking up in the middle of the night, urinate, you have lower back and knee pain, poor memory. I just lifted off the typical symptoms that are associated with this, ringing in the ears, this kind of thing, low pitch ringing in the ears. And he was blown away. He thought I was psychic or something. And I just slid some pills to him and some tea, and I said, take this for 2 weeks. It'll alleviate some of your symptoms. And then come back to me with a harder case. And he was just dumbfounded. And he said, how much do I owe you? I said, just come back in 2 weeks. It'll be better. And he did. And he came back with all of his doctors who had been treating him for years. They came in throughout the week, and that really kickstarted the first clinic that I had. And it was just recognizing this odd, from the standpoint of conventional biomedicine, it's not as textbook. But from a standpoint of Chinese medicine, it's so textbook that it was boring and I could really finish his sentences. So the more you're able to understand, what is kidney yang deficiency, how does it influence ACTH and cortisol, and how might this affect chronic lumbar pain as well as joint pain in general, it becomes much easier to help. And common home therapy that is very safe. Some of the therapies that are used in these types of pain, it's not responsible to just tell everybody, yeah, this is going to be okay for you. However, if somebody has these type of symptoms, a very safe therapy is to put a heating pad on the lower back opposite the belly button, around the base of L2, L1 through L3. This is known in biomedicine as the adrenal plexus. And studies on mice in China have shown that it has regulatory effects on the HPA axis. So because it's working in more of a regulatory manner, it's very safe. And traditionally in Chinese thought, it's called the gate of life. So it's said that if this burns out, then you're kind of toast. Once this burns out, you're unable to continue your metabolic functions in life. So this is very common advice for people to keep a heating pad or to burn certain herbs on the lower back in order to live a long and healthy life. So for people with this type of low body temperature, low testosterone, low cortisol type of pain, that's something that I feel safe and confident recommending to everybody, simply because it's already in the Chinese cultural consciousness. This is not something you would need a doctor to tell you in China. This is something your uncle would tell you.
One of the things that I'm struck by, the symptoms of this deep, deep cold, the low back pain, the knee pain, the sleeplessness. These are all symptoms that are very often reported in people going through opiate withdrawal. And we know that many people with fibromyalgia are treated with opiates for their pain, and they live in horrible fear of having their opiates removed because these symptoms are going to magnify. Do you have any thoughts on that?
Well, one that crossed my mind is that within martial art training, Chinese martial arts, there's an understanding that protecting this, the cortisol by way of the gate of life in the lower back, is associated with overcoming the fear response. So you may know all of the sweetest ninja moves, but if somebody, approaches you and you freak out and get into a ball and start crying, it's not going to work. So you really have to have the kind of poise and inner stability at a hormonal level in order to act in a state of poise. So in order to be able to keep your nerve, you have to really master this adrenal response. The increased fear and even paranoia that you can see with people who have been on opiates, people who have been in a state of chronic pain for a long period of time, I believe has a very direct interaction with this lowering of cortisol in the long run.
Right. That's fascinating. It's not all in their heads.
And the heads are, your head is all in your body, and it's all connected apparently by way of the neck. The mind and body are connected that way. That last I checked, could be wrong.
Good to know.
So when you're dealing with, either patients or family members or yourself, and you've been in a state of sickness for a long time, it's normal but not optimal to be in this kind of paranoid state. People will be unreasonably afraid of getting medications taken away, unreasonably afraid of change, to the point that a new life, that it's a healthy life, is terrifying because it's also change, and the hormonal, emotional resources available to deal with change and take it in stride are already depressed. And that can make it difficult. You may say to somebody who's a family member, hey, snap out of it. You just need to do this, this, and this. Get out of your room. Stop being lazy. However, from the standpoint of that depressed cortisol, which you also see in, very chronic stages of depression and drug addiction, the outside world, or even getting up off the floor, can look to people in this state the way that you may look at climbing a mountain. Oh, it's something that is daunting and to them appears to take more resources than they have.
Yeah. People, in one way or another, often say to me that it would be like climbing Mount Everest in their underwear.
Which you can literally do if you're Wim Hof. In other words, to get this going, you need to engage in both meditation and breathing exercises that will engage the whole body. Yes, there are herbs that'll get it kick-started, but you really need to think of that like jump-starting a car. All of these interventions are just catalysts to get you on your way. So the long term with this is to get your body's metabolism and hormones in such a state that you can maintain it. And maintaining it requires healthy lifestyle patterns and healthy thought patterns. So I've seen people who are in this state, and it's, this depressed state of cortisol, and they're watching the news and they're addicted to it because the stress response from the news is giving them the illusion that their cortisol is jumping up, but really it's just pushing a button on an already exhausted system and keeping them in a state of pain. It's important at this stage to take toll of your philosophy as well, simply from the standpoint of, if it's outside of your realm of power, it really needs to be outside your realm of concern. Unless you're powerful enough to solve the world's problems, it's probably best that you start solving the world's problems by focusing on yourself and your body, because that is within the realm of your control. The way that you breathe is within the realm of your control. The way that you're thinking or not thinking and the thoughts that you're dwelling on or letting go of is within the realm of your control. And starting there is often a more empowering place to begin, especially when it involves regulating hormones. You can take every drug in the world, but keep in mind that your own thoughts are often a pharmacy, and the thoughts that you use and dwell on and cultivate begin to cause hormonal cycles that will either heal you or maintain states of pain and inflammation.
Yes, that too can seem like a very difficult challenge for people who are already depressed to change their thoughts, but it is possible, and it's incredibly rewarding, and perhaps the only thing that you have to lose is some of your pain.
Well, that was a very fun podcast episode to do, and that concludes the 8-part series on pain. Now, obviously, there will be other types of pain that can arise from a combination of these sources and perhaps other sources as well. However, this is definitely going to cover the majority of what people are experiencing in life. And by looking more in depth into these 8 contributing factors and the stages of pain as they tend to occur in the body, we can get a more nuanced understanding of chronic pain, and in doing so, really understands ourselves better within relation to the changing world around us. Thank you so much for being a part of this. This is Andrew Miles with the Botanical Biohacking Podcast. Please remember to rate and review on Stitcher and iTunes. We love those 5-star reviews. They help other people to see this podcast. And also, please feel free to send a link to this podcast, refer it to your family and friends. This is how we keep the word out, and we can help people to help themselves.